Hi, my name's Paula. My pronouns are she, her, and hers, and I'm an associate professor of social work at Colorado State University. I'm here today with some support from Larimer County Behavioral Health Services to teach a little bit about a fundamental model in public health and social work and the social sciences called the Social Determinants of Health. And in particular, I'll talk about how the social determinants of health can help us move towards understanding and empathy for those who are experiencing homelessness. So first I want to talk a little bit about the term health and what it means to me and some definitions from the World Health Organization. So when we talk about health, we're not only talking about not being sick. There's a lot more to health than that. It's our ability really to pursue happiness, to pursue a full life, and that ability should be equally afforded to all people. Of course, we know that's not always the case in our country or in our communities, and so we arrive at a place where we have an inequitable distribution of health. But I really think of health as a fundamental human right. So we talk about the social determinants of health. We're talking about conditions that lead to an outcome. So if you think about this beautiful waterfall, the waterfall itself, the outcome, is determined by everything that came before it, those years and years of erosion that created these rock formations, the presence of gravity, how much it rained that year. This waterfall is determined by a lot of things that have nothing to do with what the waterfall itself is experiencing at the moment it goes over the cliff. So in health, it's the same. What we experience in terms of our day-to-day health or our long-term health conditions, those things are caused by things that are way upstream. Some of those things we have control over, but many of them we don't. So social determinants of health are those conditions that people don't have control over. They're aspects of their environment, where they live, where they work, what's available in their communities that really predict their health risks and their health outcomes. And social determinants of health act on us from the time that we're in utero all through our entire lifespan. So the nutrition that our little child bodies have access to, the kindness we receive from our communities, the education we receive, the opportunities we have, those are all social determinants of health. So why do we care about these social determinants of health? Well, really these social determinants are the ways by which we can prevent some of the most pervasive conditions that are faced by populations who don't have that equal access to the pursuit of health. Really, these social determinants of health are shaped by how money and power are distributed, and that gets decided at global, national, and local levels. And the social determinants of health are really what drive those inequitable access to care, that inequitable access to healthy food, unequal education across our communities. These are all social determinants of health. And really addressing and really moving the needle on a social determinant of health can improve many, many health conditions, not just one. So the CDC uses a place-based model for the social determinants of health that I think is really helpful, easy to understand, and helps you kind of have a nice introduction to what the social determinants of health are. So I encourage you to visit their website and learn a little bit more about those after this video. But they really put the social determinants of health in 5 domains: education, access, and quality, healthcare access and quality, the neighborhood and built environment, the social and community context, and economic stability. Within those 5 domains, there's several factors that act on the humans that exist within this model. So when we think about economics, we think about our own income, whether or not we're experiencing poverty, our socioeconomic position, but then there's also a lot of aspects about our community that are really important. Can we afford the cost of living there? Can we afford the cost of food? Are we able to have good food security? And can we afford and find housing, right? In the community where I live, Fort Collins, Colorado, housing is very, very difficult to come by, and it's very expensive. So a real lack of affordable housing is really driving a lot of the reason that so many people in our community are having to be unhoused. Education, access, and quality. Again, this starts in very early childhood and goes all the way through our access to higher ed as adults. Whether or not we have access to quality health care and mental health and behavioral health services is a huge predictor of how we're going to function as adults. And access is very complicated. It's not just the presence of healthcare in your community, but your ability to access that healthcare, the ability of the healthcare system to provide what exactly you need, your ability to navigate all the complex, insurance and payment options, and whether a person can understand the health information that's being provided to them, their health literacy. In the neighborhood and built environment, we think about access to transportation, air and water quality, whether or not there's neighborhood crime that causes stress on a day-to-day basis, or trauma. And we also think about the social and community context. So is there a lot of discrimination and racism in the community? What are conditions in the workplace like? What are the incarceration rates? And are people active in their community? Do they care about others? Or is it a more passive community? So when we think about applying the social determinants of health to homelessness, we really need to think about them as, factors that contribute to homelessness and result from homelessness. Living unhoused creates a significant number of health problems. And so experiencing homelessness in and of itself is a social determinant of health. If you think about what it's like to live outside, you're going to have exposure to the elements, food insecurity, you may experience frequent dehydration, there's likely to be a lack of transportation and employment opportunities, and most importantly, you're not housed in a stable way, and really that makes it impossible to do many, many things. It makes it very difficult to get a job without an address. It makes it very difficult to sign up for services without an address. Makes it very difficult to stay clean, have clean clothes, just all the things you need to pursue all of the services and opportunities that you might want to pursue to exit homelessness. Additionally, it contributes to a vastly shortened lifespan, higher experience of mental health conditions and physical health conditions as well. So homelessness in and of itself is a social determinant of health. But homelessness is also caused primarily by social determinants of health. And one of the things that I hope understanding this model can do is help you see beyond the individual. I often hear negative comments about people experiencing homelessness, and really it's the social determinants of health that contribute primarily to that condition. So social determinants of health that contribute to homelessness might be experiences of trauma across the life course. That could be in childhood, that could be as a young adult, it could be losing a parent or being unstably housed as a child. Many experiences of trauma are now known to be what we call adverse childhood experiences, and experiencing those social determinants of health does contribute significantly to homelessness, as does limited access to quality education, lack of availability of affordable housing, inability to engage with health and mental health services for a myriad of reasons, and whether or not a person can find and secure employment that meets the cost of housing needs in the community. So as we think about homelessness and social determinants of health, just remember that they're a cycle and they're contributing to each other, and that makes it even more difficult to exit this pattern. So, all of that sounds really difficult and hard to address, and people are often left wondering, like, well, what can I do? And, there's a number of things that you can do, and I can just kind of tell you what this means for me. But the social determinants of health model, to me, that really indicates that it's these larger social structures and concerns that are primarily the causes of homelessness. Homelessness is not, just a person's fault in isolation. There's all these other factors contributing to it. And therefore, the factors that we really need to advocate for and change as social workers, public health professionals, helpers in our community, really just humans who care about other humans, we really need to impact those policy and social norm level predictors and the community and organizational level structures that we can change. So my advice, if you're moved by this and you're interested in preventing homelessness, it's really things like affordable housing in a community, access to health and mental health care, getting people into housing and then wrapping them up with services afterwards in a housing first model. Those are the solutions to homelessness. I want to leave you with just some final thoughts after this introduction. I know this presentation can't go too in depth here, but hopefully this has been a interesting introduction for you. I always think of this quote, we never know what other people have experienced, what they're dealing with in a moment. And I really think understanding the social determinants of health can help you grow your empathy for those who are unhoused. So be kind, for everyone you meet is fighting a hard battle. Of course, that doesn't only, relate to people who are experiencing homelessness, but for those who are, you can imagine how isolating, how difficult the day-to-day is. And there are all these structures that make it difficult to become housed. So first and foremost, when you're working on behalf of or interacting with people experiencing homelessness, be kind, let your empathy grow, try to imagine what it's like to be in that situation, and realize that these are just people. At the heart of it, we're all just people. And then I want to urge you to consider working to change the social determinants of homelessness in your community. These social determinants may vary from region to region, community to community, but very often the primary solution to homelessness is getting people into housing. So advocate for the provision of housing to people who don't have it. Once people are stably and securely housed, then they can start to heal. They can start to pursue other opportunities, and things can grow and change from there. But without housing, it's difficult to impossible, to exit that cycle of homelessness. Advocate for access to health care, mental health care, and behavioral health services in your community, and access to healthy food in your community. I hope that you will be well, and I thank you for listening. Feel free to reach out with any questions. Thank you.